And welcome to X-ray review. In this video we're going to learn how to measure a scoliotic curve like a radiologist. Scoliosis is an abnormal lateral curvature of the spine measuring greater than 10 degrees and typically appears as an S or a C shape when viewed from the front. The most common method of measurement of a scoliotic curve is Cobb's angle. Here's how to measure Cobb's angle. First, identify the apex of the curve. This is the segment at the high side of the rainbow. Second, two angles are measured, one at the uppermost tilted vertebrae, which is most tilted above the curve, and the other at the lowermost tilted vertebrae, which is most tilted below the curve. Third, the angle between the lines drawn perpendicular to the edges of these vertebrae is the Cobb's angle, which provides an accurate assessment of the curvature's severity. Lastly, if there are multiple curves in the spine, repeat the above steps for each curve and record the Cobb's angles for each of them. Once scoliosis is diagnosed and its severity is determined, treatment options can be considered. The appropriate treatment depends on factors such as the degree of curvature, the patient's age, and the underlying cause of the scoliosis. Thank you so much for listening and hope you enjoyed this. If you did, please take a second to like and subscribe. I greatly appreciate it. Thank you.